Okay, thank you so much for joining me. Sorry about that little hiccup. We
Okay.
are here. My name is Jessica. I'm the community board member for EndoEmpower Foundation. And this month we wanted to highlight our pelvic floor physical therapists. And there's still a lot of members in our group that really don't understand what you are and what kind of services you offer. So I wanted to do basically PFPT one-on-one kind of
Yeah.
podcast. Make it short and sweet and
Yep.
just kind of let everyone understand and introduce what you are, what you do, and how it can benefit everyone. So first of all, welcome to
Definitely.
Austin. I know you just relocated from Dallas.
Thanks.
So if you want to go ahead and introduce yourself.
Yeah. So, hi guys. My name is Dr. Emily Tran. I'm a pelvic floor and a sports orthopedic performance physical therapist. Kind of do a little bit of both, but when you have an ortho pelvic brain, you just love to treat everything because it is all connected. So, I'm at Eastside Movement Company, and we're kind of like near that Mueller area right now.
Okay, awesome. So my phone. So for people that don't know, you went to school for what?
Yeah, so I went and had my undergraduate degree at Texas A&M, Whoop. And then I went on after that to UT Southwestern for about 3 years. I chose UT Southwestern just because of like the rigor and things I'd heard and people I'd met there, as well as like just having a better, like well-rounded team of people. So I was there, did about like I want to say like around like it felt like 6 months of clinicals. So you had a lot of like mentorship and as well as like you worked with patients or clients during that time. So,
And so
but
then
yeah,
you
you get yeah. So then I graduated officially with my doctoral degree from UT Southwestern.
okay, awesome. And then that's when you started seeing your ortho patients and all of your general PT.
Yeah, so I actually started in a only like pelvic health clinic in
Okay.
Dallas. So I was seeing primarily pelvic health, and I still saw like my shoulders and like some other orthopedic things like the knee and stuff. But I mainly saw pelvic health. So Liz was so awesome, and all of my people in Dallas. I got to work with a lot of my endo warriors, honestly. And they are some of my favorites. I just got a message. I think it was Liz messaging me, but literally one of my old patients literally messaged me and one of the big things that she was missing out on as a mom, but also just her and herself was being present with her kids and also just like having going back to her job. And she actually messaged me literally this past week or weekend, and she is officially back in her job and like feels good enough. But to kind of put it into perspective, she was not working. She was like missing out on everything, was just like in bed most of the time due to pain. And so it was just so awesome to like work with her these last couple months because I was there about like 8, 9 months from January to like middle end of September. And then I moved out here to Austin. But yeah, it was the best place to be. And I was really thankful for that job and start there. But now I'm here and I'm still treating pelvic health, but I am starting to see because it's Austin, everyone loves to be active.
Mhm.
So my first person here that ended up being pelvic health, she was a cyclist, and she got in a like accident, and it just made her like pelvic floor dysfunction that she has already previously had just like scream louder. So I see a little bit of all of it. But I do have a really big spot, like heart for like people with endo and then just pelvic health in general.
That was going to be the next question I segued into. Um, who should really be seeing you? Like what kind of patients, you know, um, age range, like do
Yeah.
men come and see you?
Yeah.
What's your patient load look like?
Yeah. So at my old job, I was actually seeing kiddos, men and women. So men, everyone with a pelvis. can have pelvic floor dysfunction. I actually had a male the other day come in and he has like a hernia and diastasis recti. So it's not just people that are like postpartum or things like that that might need pelvic floor therapy. So, kids that have bedwetting, or like, constipation or constant like fecal or urinary incontinence. I saw kids' ages ranges even from like 11 to as young as 3. And you can even have like little like babies. I love babies. I did a pediatric rotation and so I have a soft spot for kids in general as well. But kids can also, like little ones can also get constipation. So it's a big like education point when I see people. But it goes from that all the way to someone that was like 65 and she was like, look, I have prolapse. I do not want to get surgery. I don't want to have to wear a pessary. And we were like improving her symptoms and stuff. So from that age range, right? But I also was seeing like men as well. So, a lot of men that I saw, they had a lot of pelvic floor tension, and some that I tended to see had like a lot of like chronic neural pain. So something like pudendal neuralgia. So it can kind of span like that, right? As well as like, anyone with any form of chronic pelvic pain, or things that just kind of go under the radar. I was educating someone, this week. She's having like low back and like sciatica pain. She's had it for like years. And for me, that's like kind of like, hey, like this has been going on quite a while, hasn't gotten resolved. I've been getting a lot of those in, even just in the past couple of weeks, I've been getting a lot of my favorite peeps coming in where been going on for a while and they just don't feel validated about their pain. And I think that like really has like always struck a nerve with me that I want to make sure that people feel validated. And so a lot of those people have just chronic low back, hip pain, and like constipation, bloating, painful periods, like pain with sex or dyspareunia, and things like that, right? Like even as simple as like putting a tampon in, right? It's painful. So those are like just an array of things that I see. But then I also see, people that just want to work on posture postpartum. And then we get talking a little bit, and then they're like, I actually have heaviness when I lift and XYZ symptoms. So I kind of see the full span right now, which has been pretty cool.
I think that when I first heard about it, it was more of, you know, oh, that's for postpartum women or women who are, can't hold their urine when they sneeze. Like that's the kind of like generalness, I guess, the
Mm.
ignorance that I had about pelvic floor therapy. And I didn't realize that it was more than just that. I also learned something new. You see men, that makes sense. Muscles are muscles, right?
Exactly.
So, okay.
Yeah.
So if we were to come into your office as a new patient, what can we expect for our first visit?
Yeah, so for the first visit where I'm at, we come in, you are greeted by one of our staff. My lovely admin Kaylee is usually there. She'll like ask you if you want water. She'll probably hand you the water anyways. And she'll give you a shirt and then like have you kind of have a seat for a second. But then I'll come out and I'll come grab you and we'll kind of head back to a room. I keep the door open for a minute. I really like to make sure that you feel like you're not in like some enclosed space and kind of a stressful situation. And so at the same time, I also want like to make sure you feel like safe and have the privacy. So kind of the thing right now is I kind of like feel out how we're doing, because at the beginning I'll kind of look at how you move. But prior to that, right, I want to hear your story. And so really first thing I'm going to do is hear your story, kind of like get a big summary as well to kind of hit some like high points that I think might be important to generators of the pain or like screening things, right? Even for endo, I'm still screening, right? Even if they don't even come in for pelvic pain and they come in for back pain, like I really do screen. And, I have seen at least one person where we're like, hey, like having that conversation and opening up that dialogue, let's kind of, that kind of starts, right? And then I'll kind of look at how your body moves. So like, back pain, we're looking at the lumbar spine, we're looking at thoracic, we're looking at the rib cage moving, and we're looking at the pelvis. And right now, I really do love to, stress how the foundation of your body truly is like the two bowls, right? A flipped over bowl of the rib cage and the normal bowl of the pelvis. So I'll look at how those move and how your body moves in general, as well as like hip range of motion, just looking at everything that I can to kind of get a better picture of what's going on. Um, and then if it is like, required or, I always like to stress like a pelvic floor internal assessment's never required. It might be helpful in gaining information, but I want to see like where this objective takes us before I'm like, yeah, let's just like start with internal. Because one, like, consent is really important to me, and you feeling safe and comfortable in my space is, if anything, more important to me than anything else from that day. Because I think my biggest thing is I want people to feel safe. I want them to feel heard, and I want them to feel seen. So that's kind of how that starts. But then going from there, like, might get an external visual assessment, just looking at like how the muscles contract or don't, or like maybe like the coordination of that, as well as a look at like core contraction. And then if warranted, then we'll do an internal assessment of the pelvic floor. So what that looks like you said, it's just a bowl of muscles, right?
Mhm.
So just like points on a clock, with like my gloves and lube, we take it really slow, and I start, with just the superficial layer. So if I remove, if you imagine like removing the skin, right, that's like what there is, right? I kind of imagine it's like a triangle type thing first, like that's the first thing that comes up. And I kind of check that out, right? And depending on how that goes and what symptoms the client or the patient is having, then we'll go into the deeper or second layer of the bowl and assessing like points on a clock. Literally just feeling for that tension. I might even try and pull in how like the fascia of the body, that continuous connective tissue in our body, can be mobilized even at the pelvic floor. But yeah, so that will kind of be like a lot of that internal portion. I'll want to see again how like you're breathing. So can you relax? Can you relax your pelvis and your pelvic floor muscles when you're breathing? Because a lot of times we get really stressed. We breathe up in our chests and like our necks hurting and all the things. So we work on that and like building that like body awareness. Because I think a lot of times we like shut that out of our body if we've had pain there. Your body's really smart, and like your body's gonna be like, no, we don't need to pay attention to her. Like, we're good. And so, we'll work on that. And then, I want to get you moving. So, like, whatever your goal is, I'm going to build you up to that and choose the right exercises appropriately, as well as like manual therapy, right? But I'll introduce those things more so in like the follow-up visits. I'll give you like one or two exercises to start with because I want those to be really, really good before, we go more into depth on those in like the next follow-up visits. But that's kind of like what it looks like for me on a normal initial evaluation. So kind of the full movement, the walking, the posture, all the things as well. So
So I did hear you mention, and I just wanted to reiterate that again, some of our community has been a little gun shy about going to pelvic floor therapy because they don't want to experience the internal part of it. Is that a deal breaker for any kind of progress or a care plan?
no, absolutely not. I mean, like, here's the thing, like, the body is connected, and I constantly am talking to my patients and clients about how, like, yes, is it helpful? Sure, especially with like relieving pain and tension. But there's a lot of other ways to do that. One, I can teach you to self-mobilize if they want to, and or there are ways to like help your pelvic floor muscles relax by getting your joints to move better. So yes, we can do external, like, if people like dry needling, great. If they like manual therapy, that's great. I know those too. So it's, peeling back layers of the cake, right? Like the muscular portion of it, the joint part of it, right? And then like getting your body to accept and be in better like functional patterns, right? And then like going towards whatever that goal is. So absolutely not. I think there are several other ways. For example, like if your hip has less internal rotation, kind of the opposite of if you put like a figure four on your lap, that kind of tells me sometimes if it's decreased, there's like a lot of pelvic floor tension. So I can like read people's initial intake as like forms when they kind of fill things out for me, kind of what's going on with the pelvic floor. I don't necessarily need to, do internal to get like a bunch a whole bunch of progress. Because even with kids, there is no internal assessment, right? And even ever, I've maybe once, done an external visual, but I like never go there unless it's like actually very necessary for the parent, the child. But again, like definitely not necessary to make progress. I think there's a lot of ways to make progress.
Okay, fantastic. I know that's a big question that we get a
Yeah,
lot when we post about pelvic floor therapy. That's something that comes up often. So
for
that's really
sure.
good to hear.
Yeah.
So once you have your initial assessment, what does a typical like treatment plan look like? How long does it last? What are,
Yeah.
base it off of goals? What's the scoop?
Yeah, so 60 minutes. So we have at my office, we have a 75-minute eval. And then we always go over like the plan of care and like what like did we see at the end of that initial eval. So you get a better summary. Because I think a lot of times, you walk into the initial eval, you're like, okay, things are happening and I'm gonna come back and like we're gonna get better, right? And here at my work, like we really like to like make, dilute all of the things that are in our brain to use so that it's easier to kind of sift through all of like, the medical terminology. Because they like medical terminology and knowing that is not necessarily going to equalize to, the best daily living and function in your life, right? So for me that's like really big in our initial eval at my work. And so in a normal day-to-day like treatment session, specifically pelvic floor, right, we're still going to be thinking like holistically at your body, like what's going on at the jaw, what's going on at the neck, the breathing, the respiration, right? Is your rib cage moving? A lot of times it's not. And if you've been in pain, like we tend to like close off our bodies and we tend to tense up, right? And so like even if you have to start somewhere else, it's all connected. The jaw and the pelvis, it's a huge thing in my brain I love to talk about, super connected. For example, one of my old prior clients, like, we were working internally and I kind of listened to my clients' bodies and like nervous systems. And I can tell when we both like kind of are like, hey, like, I think this, what are you thinking? Type thing throughout the entire session. And they'll say the same thing. And one time we were working on the jaw for this particular patient. And we then were like, hey, let's recheck the muscles we were just working on. And like such a decrease in like pain and tension. For pelvic floor muscles, you kind of want like a trampoline effect. And a lot of times when there's a lot of tension, there's not. And so it was really cool to kind of see that change for myself, but also for her. And so again, like, not always necessary, but again, it really does help for a lot of my patients. But there's a lot of ways to go about it. Looking at the foot for me is also really important. Looking at your big toe, looking at how much it can extend, as well as the foot itself. So right now, even just recently, it was just a guy with a hamstring strain. He has like a hamstring tendinopathy, and I was working on his foot, and he had limited toe extension and ankle dorsiflexion, or like toe to nose motion. And because of that, your hips are going to move differently. So it just works up the chain. And I was working on his foot, and after he was like, "Oh, I feel like a little bit, better in the hamstring," but also like, that's crazy you said that, because after I, returned to running a long time ago, my foot felt all jammed. So it's just like, it is all connected. It's just what screams more, right? So your pelvic floor just has to have better coordination of like when to do certain things, right? Like when coughing, sneezing, can you coordinate the contraction without thinking? Well, and if not, like that's what I'm there to help you coordinate. And a lot of it is like coordinating the true like abdominals well in order to kind of help that pelvic floor connection, like that light bulb to lamp connection, right? So yeah, that's kind of like what it looks like. But I'm always sure to kind of like tie it back to like what's going on, like what are our goals and how can we achieve them. So I'm always going to set up the exercises to kind of relate back to your goal. Even if we're doing the foot, but your hips hurting, it might be that you don't have good motion at the ankle and good motion in and out of like arch, like falling, collapsing, and coming back up into the arch, because those are just as important for the pelvic floor. So it kind of just depends on the person, but definitely like if there is pelvic floor tension, I do like to like try and do some manual release. If not, we find another way to do that.
another way, right?
Yeah.
So, I've had a couple surgeries and we all go to PT post-op to make sure we're healing correctly. And it can be hard and it can be slightly uncomfortable. Is that something that some of your patients experience after doing their exercises?
Like kind of like, I guess, clarifying, like, are they supposed to feel uncomfortable after their exercises?
Right, like you're working muscles that you've never engaged
Yeah.
before. Like it's a workout, right?
Yeah. No,
Basically.
it is. Yeah. So I like to talk about what's called like a pain stoplight. And us at our work, we really talk about that. Is like there's a like clear and grayish barrier at the same time of like where we should be like, okay, like that's okay to work through versus, like with endo, everyone has like pretty high pain tolerances. You've dealt with this for so long, you've gone underdiagnosed for so long, like you have a high pain tolerance. So I'm always like, yes, there's a pain stoplight, but I don't want you to be like pushing so hard into it, right? So some people, right, I tell them 0 to 3 out of 10 is kind of like where I like you to be.
Okay.
But say like, someone's pain level is like a 5 out of 10 all the time, right? Like we're gonna have to like talk about like what are variables of things we can change. So like say going for a mile walk was the goal, right? Like
Mhm.
maybe that's walking on even ground or a treadmill and walking for a mile. Or if you want to make it harder and you're like, I want to go hike with my kids, right? Then we can walk on uneven, unsteady ground, like in Austin, right? And like maybe like half a mile or like 3/4 of a mile and like building up to that, right? So like, yes, it's going to feel like an exercise, right? But those things are going to help build you up so that you can fire the right muscles correctly to kind of help you be in a better position to use them and like just feel better, truly.
That's always the end goal, right?
Yeah.
So we have posted about this in our group before, but I just wanted to mention it in this call today.
Yeah.
We know that Texas for pelvic floor physical therapy, you can self-refer. Um,
Mhm.
if you are out there and you cannot get a doctor to validate you, or your OBGYN says that you're fine, or you can't get a referral,
Yeah.
a patient can just literally call your office and schedule an appointment.
Yeah, so there's a link in my Instagram bio and also like on our page to like book like a 15-minute consult call, but you can get in pretty quickly to see me, if not like next day, but like you can 10 days, kind of after 10 days or 5 to 10 days of treatment, like business days wise after like that first initial evaluation, that's when like you'd need a referral. But at my work we make it really easy and really painless. If you really truly cannot find like your own provider, we figure it out to be able to get you to be seen and continue to be seen. Yeah.
Okay, awesome. Well, I think this has been really helpful for our community. Is there anything else that you would want to add, like maybe a little tidbit or something that people just don't generally know, or, a little fun fact, something that you want to put out there while we're here?
Yeah. Okay, there's so much on my brain. I truly love the public floors. So you can ask Liz and everybody in Dallas. But I think for me it's like for anyone out there that's like watching and like really unsure of like whether they should go to pelvic floor therapy, right? It's like it's a dating game, right? Like you want to make sure that like they're a good fit for you as much as, vice versa. And so for me, like, my biggest thing is making you feel safe and know that like you can do like strong things. Because I think for a lot of it, like when you're in bed and you're like, I can't even get up, like, I can't even get out of bed, like we are going to get there. And I like promise you, like I will get you there. And it might, be longer than you're wanting or shorter than you're wanting, but it's a thing of like we're gonna work through it together. And like if you have the right fit, like hopefully it's me. And if it's not, like I will gladly find you somebody else that is a better fit. Because at the end of the day, like for me, I care about you the most and I care, about all the other things that like kind of falls away. Because the reason I got into this job and specifically in public health is to like serve an underserved population, like people that don't feel seen and heard. And like that's my like biggest passion for others is to like feel safe, feel seen, and feel validated. So like just a little tidbit, if like, you're not sure, like the biggest thing you could do is like reach out and ask. Like I'm an open book. Like if you find me on Instagram, like just literally message me, ask someone from Endo Forward, and like they'll send you my way. But at the end of the day, like most everyone can benefit from pelvic floor therapy. And if you're looking at it from an ortho pelvic lens, I am going to look at you like from the whole body and not just in your pelvic floor. Because at the end of the day, sometimes the pelvic floor can be the victim of like what's going on in totality. So that's like my big soapbox thing. But you know, I care about the endo, just like people, like all my endo forward people, and just like endo warriors in general. I have a really soft spot in my heart, but also in general, just anyone with pelvic pain. Like pain with sex is not normal. You know, like leaking, all of the things, like all the things that people tell you is normal. It's not. And it's okay to come in and get help because there are no dumb questions when you're with me. But yeah, and then like, you know, if you want to return to some form of sport, I also love to do that. But if it's just carrying your kids for the first time without like back pain or pelvic pain, like I'm also your girl. So just a little tidbit about me, but I'm here if you guys need me. But that's kind of like just a little bit about me.
Awesome. I can tell you're really passionate about the outcomes and what you do.
Yeah.
Well,
Yeah.
I thank you so much for taking the time tonight. I'm glad we finally got to connect.
Yeah,
Um,
same.
we will make sure to link your contact information if anyone's wanting to reach out to see you or make an appointment with you.
Yeah, definitely. Thank you so much, Jessica.
Thank you.